most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Frozen shoulder. We're going to show you a step-by-step exercise and pain relief for the 3 phases of adhesive capsulitis, which is a frozen shoulder. Now, this is just going to be for the first phase, which is called the freezing phase. So I'm just going to give a quick review, Brad. So the freezing phase is the first phase. The shoulder starts to feel painful. You start to lose motion. This phase can last up to 6 to 9 weeks. The second phase is the frozen phase, and these are medical terms.
Right, legitimate terms.
Yeah. Frozen phase, there's less pain, there's stiffness. The stiffness remains. It lasts 4 to 6 months. The last phase, the thawing phase, it improves, strength and range of motion gradually return. That can last 6 months to 2 years. Right now, we're just going to talk about what to do in the freezing phase.
So in this phase, the person has had it for a while, but didn't know what it was.
They may have.
Painful, less range of motion, and then they went to the doctor, and the doctor diagnosed them.
Yep.
So,
frozen phase.
You know what I mean?
Freezing phase, yeah.
So there's a few weeks that...
There can be. It might be some people go in right away when they, I just think of one of our workers right now. He got it, and he went in fairly quick.
Sure.
Fairly quick.
Yeah.
So probably within a couple weeks.
Sure. It all depends how stubborn the person is.
How bad it is, yeah, and how bad it is. So, now, okay, during the freezing phase, the first thing we're going to look at 3 things. A, you want to manage the pain.
Sure.
And you might take an anti-inflammatory. This is going to be upon the recommendation of your doctor.
Right.
Pain relief medication like Tylenol or something like that. Quite often doing an intra-articular, which means in the joint, corticosteroid shot may help, an injection.
Right. So put that needle in there.
Yeah.
And...
Tim, the person that works for us, he had it done. He had good relief from that.
Sure.
And it does give you, the studies have shown it does really good short-term relief, not great for the long-term.
Okay.
But it does improve your motion in the short-term and long-term.
Okay.
So I think I would not be opposed to having it done.
Sure. Right. If you can function better.
Right. So some other things you can try without, getting too so invasive. You could use an ice pack. Brad, do you want to?
Sure. So with the shoulder particularly, it's really nice to have one of these ice packs that are gel filled, that are flexible, and it's big enough to go around your shoulder. Usually, I always have my patients say, sit in a recliner so you can go back and has less tendency to fall off. You can buy fitted shoulder ice packs that are kind of wrap around the shoulder, and they're fitted, and they work really nice, but they cost more too.
Right.
But so you don't need to spend that kind of money.
In other words, they're actually made for the shoulder.
Right.
They're shaped. They stay on the shoulder.
I had one where you could put your arm through it and it pulled up and over, and it was really nice. But
sure.
Again,
more pricey.
Yeah, and not necessary. You can get away with a cheaper one.
That's a good ice pack from I Relieve.
Yeah.
They make a nice one.
Yeah.
So
you can make your own. We got a video on how to do that too.
Sure.
Maybe not quite
Using
as nice.
some alcohol and water.
Yep,
right?
rubbing alcohol and water.
Alcohol. Yep. Brad, do you want to show the TENS unit, which is also from I Relieve?
You bet.
So this is a very non-invasive device that you don't have to use medication if you're opposed to using medication. This is a little, it comes in a little box. It's an electrostimulator that can actually provide you some relief, and it's easy enough to use, and they've really come down in price now. So
they've been around for 30 years.
Yeah,
plus,
30 years.
And so they've got it down pat on how to make them. So this might be one option if it's. And you're gonna, where you put the pads depends on where the pain is.
Right.
But so this is an example.
You got those far enough apart, Brad? Remember, they're supposed to be at least one of.
Yeah, they're pretty close. I'll go a little farther.
There we go. Yeah. Usually we want them pads width apart at least.
Right. So.
Yeah. There we go.
Now you could use, if the shoulder was painful in a large area, you could use all 4 pads, and it covers a larger area with the same device. So you put those on, and then you have to tuck this through your shirt, the lead, and then you put that in your pocket.
Yeah, so people don't even know that you're wearing it.
Right.
And you can turn it on, and you can adjust the intensity and find out. And a lot of people get relief from a TENS unit.
Oh, right.
I mean,
Right. If you're allergic to pain, I had one patient, she couldn't take pain medication. She reacted to it.
sure.
That's a perfect situation for it.
Great for chronic pain, that's for sure. Because
Right. Yeah.
when you don't want to be on medication for the rest of your life, it really can work well for that.
Exactly.
So, all right, that's the pain relief section. Now let's talk about, you want to maintain motion as much as possible, and this can be hard. You don't have to do all three of these. I'm giving you 3 examples. Pick one, do it maybe 3 times a day, just to get some motion going. Brad, do you want to show towel slides first?
Yep.
So this is an easy one to do. Everybody's got a towel at home.
Right. A towel in a smooth surface, a
right.
table or cupboard. I'm actually going
Brad's
to
going
use.
to come over to the corner here.
Yeah, this is a nice smooth surface. And again, we can't get the shoulder up that high because it hurts and it's stiff, but you can use that towel so it smoothly and easily glides forward. And as you can see, as I push forward, my shoulder is actually flexing up. But the weight of my arm is being supported by the towel. And, you can use your body as you go further forward. What are we going to go? Are you going to go to the pulleys next, Bob?
Yeah, I'm going to do the pulleys next, then we're going to do the pendulum next, and maybe the booyah stick after that.
Sure. So again, and how many minutes are they recommending?
I would just, we're just trying to keep some motion there. I'd do 3 times a day, maybe for 10 reps.
Yeah.
Yeah.
So you're not going to be here for 10 minutes.
Right.
Yeah.
So if you want to come over here now, Tanner, what we have here is you can buy these pulleys, and they can actually, you can hang them up into a door. You can just close the door. There's a little piece on there that.
Yeah, you really can't see it here, but that goes, you close the door on it and it will not come through.
Or you can put a hook up on the wall or something like that.
I've had people go up to the joists in the basement.
Oh, sure.
Wherever you can get something to hold the
What's
pulley.
nice about the pulleys, you're really under control. You determine how high you're going to go. Let's say this is my painful side. Usually what I recommend is that you do short oscillations to start off with. Just short, getting a little movement, making it feel good. And then every so often, give it a stretch.
Yep.
Short little oscillations, and then every so often, give it a stretch. And
Sure.
people really like this. I thought, to be honest, this is probably one of my go-to things with when you have a frozen shoulder, because it's a great way without causing too much pain, and you're under control.
Right.
So, do you want to show the pendulum and the booyah there, Brad?
Sure. So the pendulum, this is also known as Codman's in the therapy world, but it's where you just use the weight of the arm itself and relax the shoulder as much as possible. You're going to breathe relaxed. I'm going to lean on this chair. A lot of times people lean on a table, and you just lean forward, and you can see my shoulder is coming away from the body, so it's flexing, we're going to call that. And then what we're going to do is I'm going to move my body and see if I can get my arm swinging. One mistake a lot of people do is they just go like this.
Right.
And it's really not the way we want to do it. We just want to have it relaxed. I say just pretend your arm is like jello. Move the body to get the arm moving like a pendulum. And that's why they call it pendulum.
Right.
And otherwise Codman's, because Dr. Codman evidently.
Yeah, and you can go in a circle if you
right.
want.
Yep.
You can.
That's a little more.
Right.
I'll have people go forward and backwards for 10 repetitions, right to left for 10 repetitions, and then circles 10 repetitions. And that kind of covers all the range
the
of
whole
motion.
ball wax there, right? So
you can use a stick like this. This is 5 foot long. You don't need it 5 foot long. It's probably going to be not needed up here at this phase, but later on you would use it. So I'm just going to grab here. A tall cane would work. And I'm just going to go forward and have a pivot point on the floor. And here, let's show it this angle. And that will give it a stretch. And if it's too much stretch, simply let your arm lower on the stick. If more, you go higher. And you just go back
I want to
and forth.
emphasize, you don't need to do all these. Just pick one.
Right.
Do something to get motion.
Yep.
You can also, did you mention the ball, Brad?
No.
You could use the little ball on on the flat surface too.
I've used this a lot with patients because a lot of people have a little ball around, and they're so frictionless because I like it better than the towel because it just rolls and you just do this, and as you can have a higher surface, or you simply, as it gets better, lean more into it. Oh, is Sam in the way, Tanner? The skeleton? It's okay. And again, you do that for 10 repetitions as well. Either one of these.
And some people take a ball like this if they have an exercise
The big
ball,
exercise
and
ball.
they can do the
Yep.
exact same thing.
Yep.
So the third thing we want you to do when it's in the freezing phase, we're always concerned that you maintain your posture, especially when this is all said and done. We want to make sure you have good posture because it's going to make sure that you get full recovery of your shoulder.
Right.
So I like to do the W's, just squeeze the shoulder blades together as much as the shoulders will allow you to do this, and doing a chin tuck while you're doing it. Now you can also do T's, which is straight, make it a T, going straight back for the pec. And you can also do a reverse Y.
Yep. These are done best standing.
Yeah.
We're sitting because Bob's too tall.
I'm too tall. You won't be able to see me.
You can't see his head.
So that's basically it right now during this phase. You want to get through it because it can be a painful phase, and it also can affect your sleep.
Oh,
so that's
sure.
why it's good to do these things. Like sometimes put the ice pack on before you go to bed.
Sure.
And
get you to sleep.
Yeah, you get it so the pain won't come back until it's thawed a little bit. Oh, I failed to mention that again. This is a part of a series of videos on shoulder pain, and this one actually there's 3 videos on how to treat a frozen shoulder. This one was for the freezing phase. The next one's for the frozen phase, and the last one's for the thawing phase. So go to bobandbrad.com, go to the program section, go to shoulders, and you'll find it in there. You'll find the titles.
Right. And again, all these videos do have PDF printouts.
Right.
So you can get on paper the exercise. If you can't remember them, you'll be able to see it on paper, and then you don't have to go back to see the video every time.
For your convenience.
There you go.
Thanks.